Welcome to the course on control of diabetic retinopathy. In the fourth module, which is also the last module of the course, we focus on understanding the health system. This is very important given that diabetes eye care services are usually delivered within a health system. The health systems framework of the World Health Organization illustrates the link between health systems and health outcomes. In a strong health system, we have well-functioning building blocks such as service delivery, health workforce, and information. In addition, we have good access to services through removal of the barriers to access such as cost or distance. There is good coverage with the interventions such that those who need the interventions, even if they are hard to reach communities, they get reached with the intervention. These interventions are of good quality and they are delivered with safety considerations. The likely outcomes are that there is improved health, meaning that, for example, there is preservation of visual acuity, there is protection of the patient from catastrophic financial expenses, and the service delivery is efficient. On the other hand, a weak health system is likely to have weak building blocks, and this will lead to poor health outcomes. Within the health system, services are provided in a structured and often hierarchical manner. We have the community level, the primary level, the secondary level, and the tertiary level. At the community level, we often have health promotion activities. This might include patient education, self-management, and regular monitoring of parameters such as blood glucose and blood pressure. At the primary level, we have treatment for diabetes. We also have education, and we might have screening for diabetic retinopathy. At the secondary level, we have all the services provided at the primary level, but in addition, we have treatment for diabetic retinopathy such as laser treatment and intravitreal injections. At the tertiary level, we have treatment of complications such as vitreous hemorrhage, which may require surgical interventions such as vitrectomy. We also have rehabilitation for patients who have visual loss. Rehabilitation may also occur at the community level. We see that we need a continuum of services throughout the health system, starting from prevention and going to rehabilitation. All these services need to be offered in a cost-effective manner. We often use the terms primordial prevention, primary prevention, secondary prevention, and tertiary prevention when describing the continuum of services that are required in the control of blindness from diabetic retinopathy. In primary prevention, we aim to prevent diabetes in the population. We will need to address the social determinants of health that are relevant to diabetes. This might include designing policies that improve our food choices and the availability of healthy foods in the market. We may also need to design physical infrastructure that encourages an increase in physical activity. In primary prevention, we aim to detect diabetes early and to institute lifestyle modification so as to control blood sugar and other metabolic parameters. This will help to prevent or delay the onset of diabetic retinopathy. In secondary prevention, we aim to detect diabetic retinopathy early enough and to institute treatment in a timely manner for diabetic retinopathy. We also aim to prevent complications of diabetic retinopathy through lifestyle modification. In tertiary prevention, we aim to treat complications of diabetic retinopathy, such as vitreous hemorrhage treated through vitrectomy. We also aim to provide rehabilitation for patients who already have severe vision loss. What services are you providing? How can you improve the scope of the services available in your setting? Diabetes is associated with several chronic complications, including retinopathy, kidney failure, foot complications, and neuropathy. The risk of developing these complications is a function of several factors. These include the level of blood glucose control and the duration of diabetes. As the duration of diabetes increases, so does the risk of developing complications. As the level of hyperglycemia increases, so does the risk of developing complications. In a well-functioning health system, diabetes is detected in a timely fashion, and effective measures are put in for control of blood glucose because this is a modifiable factor. This intervention delays or prevents the development of complications. However, in most parts of the world, 50 to 60% of people with diabetes remain undiagnosed. In many cases, the diagnosis of diabetes is only made when one of these complications has been detected. This means that the complications cannot be prevented because diagnosis of diabetes has not been made and effective measures for control of diabetes have not been put in place. How can we strengthen the health system so that diagnosis of diabetes is made early? We will be considering this in this module. The second thing to note is that once a complication is found, it is very likely that the patient also has other complications. What are the implications of this in your setting? As we have seen, a patient who requires diabetes eye care services also requires a broader spectrum of services relevant to diabetes. The patient may have other complications of diabetes that need to be attended to as the complication of diabetic retinopathy is being addressed. This means that we need a patient-centered approach so that we focus on the whole patient and we make decisions that are in the interest of that patient. To what extent can we integrate diabetes and eye care services in your setting? And to what extent are the services provided for diabetes patients patient-centered? This illustration helps us to reflect on the extent to which services are patient-centered. If we think about decision-making between the patient and the physician, 4 different scenarios can arise. In mutual partnership, the patient and the physician are active in decision-making. In paternalism, the physician makes the decisions and the patient is passive. In consumerism, the patient drives the decisions while the physician is passive. In the default scenario, both patient and physician are passive. What are the benefits of mutual partnership? Give examples of when paternalism or consumerism have been applied in your context. How can we move towards mutual partnership so that our services can be patient-centered? Thinking about services for DR, how can we improve uptake of services through applying patient-centered care? In this module, we will also link the concepts we have discussed to universal eye health. There are 4 parameters in universal eye health. 1. That services should be comprehensive. They should include the full range of the diabetes eye care services that we have discussed. 2. That everyone who needs a service should have access to the service. This includes the hard-to-reach communities. 3. The diabetes eye care service should be implemented within the health system. And 4. That the services should be free for the poorest to ensure that there is equitable access. To what extent is the universal eye health being implemented in your context? We will then consider the health system factors that can improve the uptake of DL services in your context. These include patient registers, patient reminders, use of clinical guidelines, strengthening referral systems, developing insurance systems, and developing rehabilitation systems, especially low vision services. By the end of this module, you should be able to apply the concepts of universal health coverage and universal eye health to diabetes eye health, compare strong and weak health systems for diabetes and diabetic retinopathy, plan for a service to reduce vision loss from diabetic retinopathy, and appraise the position of the patient in the health system. This work is licensed under the Creative Commons license for attribution, non-commercial, and share alike, and you are free to use, reuse, and share the materials so long as you use the same license. Welcome to the module, and we hope it will be beneficial.